COVID-19 and nutrition, what to do. I'm sure you've been hearing mixed messages, so I felt like it's my responsibility as a dietitian to hop on here, help give a big picture understanding of some of what we know and don't know about nutrients for COVID-19, and then what we can kind of draw from what we do know about nutrients and how they can help to prevent other viruses, and of course weighing the potential benefits with the potential risks. Now, I just want to start out by showcasing the study that was done in hospitalized COVID-19 individuals using vitamin C or ascorbic acid. And what they found, and this was in China and USA settings, because I want people who don't quite understand the power of nutrients to just kind of see from this study how powerful they might possibly be. And so here highlighted, the average COVID-19 patients had 30-day hospital stays, but COVID-19 patients that received the intravenous ascorbic acid, so basically that vitamin C going into the vein, had a hospital stay that was 3 to 5 days shorter than the non-vitamin C treated patients. And they concluded that the inclusion of the IV vitamin C as a part of combination care of everything else they're doing in the US is reasonable and supported by direct experience with COVID-19. It's safe, cost-effective, easy to implement, kind of like what we talk about with nutrition in other settings, right? For hospital pharmacy and nursing staff. So in their experience, it also shortened hospital stays 3 to 5 days compared to those not receiving it. And last I heard from one of our local hospitals, the average length of stay, the average time on a vent for individuals with COVID-19 has been 11 days compared to the normal average, which was 4 days. Now, that was a few weeks ago when I heard that, but decreasing length of stay would then be huge to kind of free up some of those hospital beds and resources for the curve here. And so that's promising. I think what's also kind of exciting is looking at some of these other possible combination treatments or therapies, or whatever you want to call it. Now, we don't have research on melatonin with COVID-19, but what this article in Life Sciences is talking to is that based upon how we understand that melatonin works, it might be reasonable to try it in individuals with COVID-19. So let me just read this highlighted part here because I think you might find it interesting. Melatonin, a well-known anti-inflammatory and antioxidant molecule, is protective against lung diseases, so acute respiratory distress syndrome, acute lung injury caused by viral and other pathogens. Melatonin is effective in critical care patients by reducing vessel permeability, anxiety, sedation use, and improving sleeping quality, which might also be beneficial for better clinical outcomes for COVID-19 patients. I mean, when you're sick, and can you imagine not sleeping well and trying to recover? So just sleep. And from my experience working in the ICU I used to actually be an ICU dietitian. Sleep is so important for helping people to recover. And if somebody's already doesn't have a good sleep schedule going into a hospital setting, it's harder to sleep in a hospital setting. Granted, that's people who aren't being sedated and things, but notably, melatonin has a high safety profile. There is a significant data showing that melatonin limits virus-related diseases and would also likely be beneficial in COVID-19 patients. Additional experiments in clinical studies are required, of course, which a lot of this, because this is totally new to us, so we don't have good research on it, so we kind of have to pull from what we know and how we understand these different nutrients, these different medications to work, and try to figure out what's going to work. And so let's dive in then to prevention until we can get some more information on the acute care setting. But I want to just show what the Institute for Functional Medicine is recommending, and then also this article from the Explore Journal, Integrative Considerations During the COVID-19 Pandemic. So again, no integrative measures have been validated in human trials as effective specifically for COVID-19, and that's probably why you're hearing a lot of mixed messages online. And so what I just want to do is I just want to show you where I'm pulling the information from from the source, and then you can kind of decide based upon your situation and your providers what would make the most sense for you. Sleep. Shorter sleep duration increases the risk of infectious illness. We were just talking about the importance of that, importance of melatonin. You have more melatonin secretion within the 3 hours after the sun sets, so keep that in mind. And if you ever notice that you get a second wind at night, it certainly could be because you had the melatonin production after the sun set. You waited too long, and now that the amount of melatonin going through your body is lower. So, a molecule which may play a role in reducing coronavirus virulence. Stress management. So, we know that stress disrupts immune regulation and is specifically associated with increased pro-inflammatory cytokines like interleukin 6. So, whatever you can do to decrease your chronic stress, maybe it's just giving yourself a limit for when you can watch the news if that's what's triggering stress in you, because you're on social media all day, you're watching the news all day, and you're just constantly in this fight or flight mode. So getting out in nature, if you're living in a place that's still allowing that, can be really huge. Or just kind of thinking of what else could decrease that for you. Zinc. Coronavirus appears to be susceptible to the viral inhibitory actions of zinc. So it may prevent entry into the cells and appears to reduce coronavirus virulence. Typical dosing 15 to 30. Now, interesting thing about zinc is if you supplement with zinc for too long, you could cause your cell to have a copper deficiency. Now, that's not common. However, I am going to assume that it's becoming probably more common as more and more people are taking zinc for some of the other things that they're hearing zinc can help with too, such as gut health and leaky gut. And so it is more common to have a zinc deficiency, but please just note that we at our clinic, at the Digestive clinic, we actually test micronutrients so we can know exactly what people are low in. And I actually had 2 clients recently with replacing micronutrients and making some other changes. Their moderate to severe anxiety is now mild despite this COVID experience. So it can really make a world of a difference to replace micronutrient stores and then, use food and nutrients, food as medicine, to keep those stores level. But certainly taking some zinc for most people for a few months likely won't cause major issues. But my disclaimer, all this is just knowledge. It is not recommendations. So always check with your main healthcare provider. Now, food, vegetables and fruits, and flavonoids. So many flavonoids have been found to reduce certain inflammatory signaling, and you can find these in the diet from all these foods listed underneath it. So some of the ones that are most commonly eaten would be the onions and the apples and the tomatoes and oranges and nuts and berries and parsley and celery, chamomile tea. You can make turmeric tea. You could add turmeric root to your eggs, which is actually really good. If you freeze the root and just shave it off into your eggs, can add some flavor. That and ginger. And if I say freeze because it grates easier if the root is frozen. Or if it's fresh, keep it in your fridge and just slice them off into hot water, make some tea. There's some green tea is a part of this. And then at least 5 to 7 servings of vegetables, 2 to 3 servings of fruit daily provide a repository of flavonoids and are considered a cornerstone of an anti-inflammatory diet. Now, let's see what else this article has to say. We're talking about vitamin C here, and as mentioned, and as you saw in the inpatient study, found that it can shorten the frequency, duration, and severity of the common cold and pneumonia. So again, like nothing for prevention of COVID-19, but this is a totally new thing to us. So we always have to weigh the pros and cons, and I'll just say for me, I had some vitamin C here already. From what I know about it, it's safe. I feel like I'm at low risk of taking some, and so I'm taking it every day, and there might be a potential benefit. So you just have to weigh that with you and your healthcare providers, but dosing ranges 500, 3,000 milligrams or even higher during times of acute infection. Now, melatonin we talked about already. You saw the top of this study, so you can look this up yourself if you want to read through it closer. Elderberry can be helpful. And if you saw my video on the flu, there's research showing elderberry to help with the flu. And what's actually funny about that video is I think I actually got COVID in January. So I think that when I said, I never get sick, I got the flu this year, I think that was actually COVID because I caught it when I was traveling to LA, California, in a hostel, which would be one of the most likely places to catch COVID. And so just interesting, but I thought it was helpful. Of course, you can't really prove what really worked, but appears to be the most effective for prevention or early stage of the coronavirus infections. It can, of note, you might have heard mixed recommendations because it can also increase inflammatory cytokines. So if you ever start to get, symptoms of this infection, this COVID-19, I recommend you stop the elderberry syrup just in case, just to play it safe, because you've probably read about the cytokine storm, this inflammatory storm that can happen. And if it might increase that, then that's going to not be working in your favor. So that's also why you've heard some recommendations from different individuals to stop the vitamin A and also the vitamin D if you're in the acute infection stage. And so vitamin D, though, on the other side of it for prevention, certainly very important for the immune system, healthy immune system, decreasing inflammation. I live in Minnesota. We have not been absorbing it from the sun. Even when it's winter and it's sunny, you're not getting much of any vitamin D from the sun because we can only absorb it between the Memorial Day and Labor Day in summer here in Minnesota. And so most Minnesotans are low right now because we are just coming out of winter. So it might behoove you to check your levels or just supplement for a few weeks. It's pretty safe. Most people are low. Check with your healthcare provider. But once we do hit the summer months and get in some sunshine and absorb it through your sun, because that's really the best way to absorb vitamin D. And so again, use with caution, perhaps discontinue with symptoms of infection as I just mentioned. So this is here to avoid during the infection or with a positive test. And I think this is really important. It's again weighing the potential benefits with the potential risk. So we have the elderberry here, medicinal mushrooms, echinacea, and then vitamin D as talked about. Now again, I will scroll up to the top so you can read through this a bit closer because a lot of these things, again, safe prior to the acute infection state. And just a note on vitamin A, if you're getting a recommendation to use that for the immune system, just know that if you're doing high dose, that can be toxic to the liver. So just be careful of the type of vitamin A you're taking and how much. Okay, so that's that study. Now let's hop on over to what the Institute for Functional Medicine is recommending, and I bet it might just be in alignment. So curcumin, we talked about it. Quercetin, we talked about it. We talked about fruits and vegetables. Zinc, we talked about. NAC, we didn't. So promotes the production of glutathione, a potent antioxidant that supports immune function. It also reduces the severity of the flu. So really, for immune system health, it's important to get enough protein, you guys, and enough amino acids from protein. If you're a vegan, maybe even vegetarian, just be extra mindful of that. Most Americans do get enough protein, but just be extra mindful of it during this time and get some good quality meats, nuts, seeds, beans. If you have access to good quality fish, you're getting some omega-3s in that for anti-inflammatory benefits as well, which would be great. So we have also vitamin D, vitamin A, vitamin C. We talked about all these. Melatonin, we talked about elderberry. And then a few of these we touched on a little bit, but I'll let you kind of read through that for the sake of you not being bored with my video. So I really hope this was helpful for you guys. If you are looking for a good quality source for professional grade supplements, I will have a link in the description below. If you're looking for some extra support on your gut health, we are still taking clients at Oswald Digestive Clinic, and we also just released our group consults, it's very exciting. It's a 1 hour meeting once a week. You do not have to sign up with a friend or anything. Marcy, our licensed nutritionist, will give a presentation on the topic for the week, and then it's going to be Q&A and discussion about the topic and about anything else that the members want to talk to you. So just a more affordable way to get access to a licensed nutritionist and get questions answered that, might be more difficult to figure out a solid answer for online, because there's so much to sift through online nowadays. So I hope this was helpful. I hope you guys have a wonderful day, and I will talk to you all again soon. All right, bye. Hey, so just wanted to hop on here again and just share with you that this was published April 7th, so less than a week ago, and they are going to do some more clinical trials with high-dose vitamin C in people with COVID-19. So this was published in a critical care journal, and I think that's very exciting. All right.